this the mic here. Okay, so I'm going to talk to you about the National Survey for the Care System. I think a very good background of this survey is in Latin America, in Mexico particularly, we have been really focused on studying care that is provided by members of the household, unpaid activities, and so on. So this is the consequences of many, many years of work regarding particularly the engagement of women in care activities in the household. But before going into detail, in order to create this survey, this is a new survey. It's the first time that we collected the information last year. So we have to go and start looking for similar studies or examples in different countries that have done the same. So we have to study what they have been doing in Singapore, in the UK, Canada, in the US, for some examples of surveys that were collecting information on caregivers, and also the recipients of care, to understand the experiences and how we can create a survey for Mexico in order to collect the information that we needed. So as I was telling you before, this is not the only survey that collects information on care. We have a long tradition in Mexico, and here I'm just starting in 2009 with the National Time Use Survey. But way before that, in 1998, we collected information on time use for the first time. And one of the dimensions that we study in the time use survey is essentially the care that is provided in the households. So after the ENUD in 2009, we had some other experiences such as the Labor and Social Co-Responsibility Survey, trying to understand how households balance paid and unpaid work, essentially trying to understand the differences of the gap between men and women. And then we have some other time use surveys and some specialized survey with Social Security. So with all these experiences and the experiences from other countries, we designed ENASIC in 2022. And we essentially were trying to focus on several dimensions that I'm going to mention in the next slides. So we needed this information first because we want to know, to understand the need for coverage and the need for and coverage of caring households. So that is a big question that we had. We wanted to know how many people are in need to receive care, and also how people or how households are providing this care. But also to understand the characteristics of those providing care, the caregivers, and how they balance employment and other activities with the care that they provide. But also trying to understand the perception and the cultural perception of people and households regarding care, like who is the person or who is supposed to provide care in the household, trying to understand this in order to create policies, and of course understand gender disparities and the incorporation of caregivers into the labor market. And we have some questions regarding active participation of fathers and mothers, particularly with when they have children that are not living with them, to understand how they engage in this care. So methodologically speaking, ENASIC is a survey that follows the design that we usually have at INEGI. We use face-to-face interview. We use mobile devices to collect the information. There's also one section that was self-reported. Essentially, we were given the device to the interviewees in order for them to provide the information without having any issues with confidentiality, or essentially making them feel safe, and so they could provide the information. The sample size is kind of small compared to other surveys that we have in INEGI, but it's enough to characterize the national population in Mexico, to understand what is happening in the country. Sadly, we are not able to get estimates for the states, but at the national level, this survey, the sample size was enough. And in terms of design, was a probabilistic. The three-stage design essentially is, once we reach a household, we selected one member of the household to provide the information. So that was an additional selection that we had. And again, we were really concentrated in understanding the characteristics of the households, also caregivers, and target populations. And target populations were people with disabilities, regardless of their age. Also children ages 0 to 5, children and adolescents ages 6 to 17, and people ages 60 and older. So essentially groups that we decided that were already in need of care. If I go really fast, let me know, because I tend to. Sorry, I'm from Tabasco, so I usually speak really fast. Okay, so the first thing that we found was that essentially we have 77% of the households that we have in the country had at least one person that would require care. Essentially one person who belonged to any of these groups that I already mentioned, people with disabilities, children, adolescents, teenagers, and persons ages 60 and older. So essentially we have almost 78% of all households in Mexico with at least one person in need of care. And not only that, like 12 million households had only one person, but we found 2.3 million households that have at least 4 or more persons in need of care. So this is just the target populations. This was before asking if they were actually receiving care, only to identify the potential population that we have in terms of care. Now, when we look into the number of people, essentially, in the country we had, in 2022, 129 million people, almost, we're getting there, and we identified 5.6 million people with disabilities or dependency, essentially those who had great difficulty to perform daily activities of life, 10.3 million of infants, 25.4 million of children and teenagers, and 17 million of older adults. And this is a group that we have to pay attention because this group is growing really fast. Because, of course, Mexico, as many other countries, has an aging population. So we have to keep track of this population. And we only have here the break between men and women, but essentially we didn't see any significant difference except for the people ages 60 and older, because we know, as you probably know, women live longer than men. So that's the reason we have more women than men in that group. Well, and we add all this population, we have 58.3 million, essentially meaning that 45% of all people in Mexico have a need of care. Again, probably people are not asking to be cared for, but essentially we have this potential population. Now, when we ask about, okay, we identify this population, they were in need of care. So are they receiving the care or some form of care? Essentially what we found was that 64.5 did in fact receive some form of care. But when we go into specific groups, we see that infants ages 0 to 5 were the group that received the most care. Essentially, people taking care of little kids in the household. So 99% of all those kids were receiving care. I wonder what happens with the other 1% that did not receive any form of care. But again, that's something that probably we have more questions for future surveys. And then also the next group was the children and teenagers, and then people with disability, and those ages 60 and older, only 22.4% receive care. This something important before going to the next slide. This care was provided for someone in the household, but also for people living outside of the household. If we think about all like elderly population, probably some of their kids or children living out in some other household, they will go every day and provide care. So they don't have to live with them to provide care. Okay, now we identify the population or the potential population that could receive care, and then those who were receiving. So we started breaking the information down by specific target populations. And when we pay attention to those with disabilities or that need some additional support for activities of daily life, we started asking some specific questions. So the first thing was that only 3.3% of those with disability were attending some center for education or daycare or something that was associated with the disability or that could provide help, care for them. And when we started asking, okay, so what are the things that you need, or like for those providing care or for those receiving care? So what are the things that you need in terms of care for you or for this person? Most of them actually said that was some physical stimulation, some therapies on a daily basis, but also the support of nurses or some caregivers that could go to their households and essentially taking care of these people. But also, and this is interesting, more support from other members of the household. So if we have a large family living together, people were reporting that the help that they were receiving from other members of the household was not enough. So we're asking for people to engage more on these activities, but also support from neighbors, from friends, from other relatives living in a different house. And yes, of course, we have the daycare center and special education schools, but those were not the most important in terms of what people were reporting. Now, paying attention to those infants ages 0 to 5, here it's important because if we break this age group between those ages 0 to 4, most of the kids were not attending any early education or daycare, essentially, facility in Mexico. But from ages 3 to 5, we see an increase on those going to kindergarten, essentially. So it has to do with the age that these kids have. But also when we ask, okay, what are the things that you need in order to provide care or in terms of care? Again, the early stimulation or early programs were really significant, but also, again, support or more support from other members of the household, as well as having some nannies or support from friends or neighbors in order to take care of their kids. When we move to the next age group, and this is important because ages 6 to 17 are those who are supposed to go to school, like primaria, secundaria, preparatoria. Here we see a significant change. Essentially, most of those ages 6 to 12 were attending school, essentially going to primaria. Then we see a decline. 16% of those ages to 12 to 17 were not going to school. So secundaria, preparatoria, we have 84% of those in that age group attending and 16% not going to school. And again, asking like what are the needs that they have in terms of care. Similar to these daycare facilities or centers for activities, in this age group we find this center for extracurricular activities, essentially after school activities like soccer, gym, or some similar activities, but also, again, more support from household members. So we see a trend here that more support from other members of the household is really something common that we see in the answers that we receive in the survey. And in some scenarios also extended hours schools in Mexico that are not widespread in the country, so people were reporting that as something that they probably need. And when we go to the other group, those ages 60 and older, again, the main thing that households reported that they needed was nursing staff, some caregiver support from other members of the household, but also the possibility of sending this population to special education centers, activities that will provide them care, but also some opportunities to have so for arts and crafts or activities that will keep people active in this age group. Now, we studied those ages 60 and older living alone. So we wanted to know how these people were living or what they were reporting in terms of care. And the number one thing that they mentioned that they needed was just essentially company, somebody to keep them company during the day. And this was the same for men and women. Only for women was most important that they reported that they needed somebody who could take them to the doctor or for appointments or to get medication, pharmacias, and those things. But essentially, we see that a company was the number one thing that they were reporting. And then also assistance going like shopping, doing paperwork, going to the bank, and those activities that people probably in this age group are not really familiar or they have not the possibilities to move by themselves. So they were asking or they were reporting that they needed assistance with all these activities, but also with housework and essentially personal grooming needs. Now we start looking at those providing the care. So who are the caregivers in this population, the Mexican population? So for persons with disabilities or for some dependency, the main caregivers were the daughters, mothers, or spouses. Essentially, when we add these three groups, we have essentially like almost 85% of the population providing care for people with disabilities were either the mother, the daughter, or the spouse. For children or for infants ages 0 to 5, essentially the mother was the number one provider of care, and the second most important was the grandmother. For children ages 6 to 17 was the mother, and here the father was the only time that the father actually popped out as the second option, but it was only 6.6%. And for persons ages 60 and older, we see that the main provider of care was the partner, but also daughters or granddaughters in this scenario. So as you can see, those providing care essentially are women. In most scenarios here, the mothers, the daughters, and we can essentially probably think that the spouse or partners, we can essentially, those providing care are the wives. Now, what happens with a population are providing care? So the first thing that we see is that we have more women participating in care, like 45% of women are providing care than men. Only 17% of men are actually providing care or report providing care, which translates into almost 24 million women being caregivers in Mexico and 8 million of men. And also, not only are differences in the engagement rates, but also the time that they spend in these activities. For women, it's essentially a full shift in Mexico. Well, that would be 40 hours a week, 38 hours for men, only 25 hours. So again, what we are seeing at this point is that most providers of care are women, and also women are spending more time than men in these activities. Now, those were the numbers that I gave you before were just those providing care. When we ask, okay, so who is the main or the primary caregiver? So the person that you actually will identify, the person who's taking care of this person the most for most of the time. Again, women were the main providers of care. For people with disability, 80% of caregivers were women. For infants, 96% were women. For children and teenagers, 90%. And for senior citizens, 67% were women. This doesn't mean that there are not men providing care. Of course, we have some percentages of men being the main providers of care. But essentially, we see again that this picture is essentially, we have more women than men in these activities. Now, just to characterize this population, most providers of care, well, women particularly, are between ages 15 and 39. They're in a union. They're either married or in cohabitation. They're also in the labor force. Like 50% of women providing care are in the labor force, compared to 82% of men. And again, the number of hours that they work in a paid activity are women spend fewer hours than men in paid activities, also associated with the longer hours that they spend providing care for somebody who needs the care. And of course, something really interesting of this survey was that we could identify impacts on the health of these the care providers. So the first thing that they report, and this essentially all these symptoms were reported most frequently by women than by men, was just being tired, essentially having fewer hours of sleep, also having some symptoms of depression, but also some physical deterioration of their health status, even just becoming ill or having some problems with their health because of the care that they're providing. So associated with the care that they're providing, they reported these things happening to them, and we see that more women than men are reporting these impacts. But also we have economic impacts. Essentially, women were more likely than men to report that they couldn't work outside of the house, of the home, because they're providing care for somebody who needs the care. But also those who are working reported some reduction in their income, or they have to borrow money from somebody else in order to cover their daily needs. Also, we have women that reported that they had to stop working at all in order to focus on the care that they're providing. But for those who are still working, also some impacts on their professional career. Essentially, probably they couldn't accept some promotion because they have to provide care, so they were having conflicts on the schedules that they would have to work. But we also have information on the social impacts on social life for these providers, because it's not only health-related impacts, but also in other dimensions of life. What we have, the number one impact was on the spare time that they have for leisure activities or for doing something else. But also in studying, and this is important, you can see the gap between men and women. Women are being really or heavily impacted in the time that they have to study. And this can be like some formal studies, but also some learning some other activities that they could use to have some additional income. But also in the relationship with the family, as probably you remember the first slides, they were reporting that they needed more support from other members of the household. And we can see another reflection of this. They have had problems in relationship with family, essentially asking probably to provide more help is something that is creating some conflicts, but also problems with their friends, co-workers, with their partner. And something important is a couple of slides before, you saw the percentage of women that actually reported that they had to stop working. But also, if we pay attention to those who are not working, a lot of them report that they would increase the number of hours they're working, but they need somebody who can take care of the person who they are taking care of. So we have a significant percentage of women that are providing care, like 16% of women that they say they would increase their working hours. And we can see why, because for those providing care, which is the first part of this graph, we see that those that are working fewer than 35 hours. For those not providing care, women not providing care, the most significant group are working between 35 to 48 hours. So we have a significant difference in this number of worked hours. And again, like trying to dig more into specifics in this dimension, 2.5 million of women decided that they were willing for work for income, but they don't have anyone who can take care of their children, the person that they're taking care of. But we also have 3.8 million women that say that they're not willing to work or they're unable to do it so because they don't have anyone who could take care of the person they are providing the care for. Essentially, what we have here is that 3.8 million women, they are not looking for a job. Essentially, they say, there's no reason for me to look for a job because I don't have the support at home. So essentially, they report that they cannot do it. Mm-hmm. And when we started asking, okay, so now let's think about like the ideal characteristics of the care facilities. So this would be for early education centers. What are people looking for in these centers in Mexico? The number one option or the number one characteristic was they were looking for centers with qualified personnel, essentially people who have the credential for taking care of children, but also safe places, clean facilities, that they treat the kids in a good manner, but also schedules that can feed their working hours. When we ask about, okay, if you don't want to take your kid to daycare, why is that? 53% of the population said that because they believe that caregiving is the responsibility of the family. Essentially, families have to take care of children, or that was the number one, and then we see it really with a lower percentage, the impression that kids are mistreated in these places. Now, for senior living facilities, the number one characteristic was, again, personnel with the qualifications for taking care of these people, but also that some facilities were safe, they were clean, they have enough food and recreation activities. And now, as I mentioned at the beginning of the presentation, we also have these questions about, okay, so how are you engaging with your kids under the age of 18, not living with you? So the number one activity that men and women reported was just demonstration of affection. It could be on the phone, like talking to them, asking them about their daily lives, but also asking about their friends, the friendship, the school, how is everything going, but also attending school meetings, on festival, Dia de la Madre, Independencia, and those things, essentially going to these activities at school. And something really interesting was that we were able to select only those men who are not living with their kids under the age of 18. And even though most of them say that they think that they are covering half of the needs of their kids, or probably more than the half of the needs of their kids, we have 18% that say that the money that they're providing to their kids covers less than half of the needs that they have. And we have 4.2% of men saying that they have no information or they are not providing any support to their kids. So that was something really, really important in this. So with all this, I'm not being fair to this survey because it's really, really big. We had lots of information in the survey, but this was just a snapshot of the main findings that we have. So thank you, and here for any if you have any question.
Good morning. Thank you very much to the Center for Youth Mexican Studies for inviting us to making some comments to the ENASIC survey. And we are currently doing a research project about the childcare policies in Mexico. So we depart from that project in order to make these comments. Karen Covarrubias, who is here, she's a postdoctoral visiting scholar at COLEB and is collaborating with this project. So, well, as I said, we are doing this project, and we would like to show how the ENASIC survey can help us to support the findings of this research. I am so happy that INEGI carried out this research. In the past, I used another survey, the ELCO survey, in my work about social care. So I think this is very important. And well, the research project is called Childcare Policies, Work and Gender, the Privatization of Care in the Families in Times of Austerity. Sorry about my broken English. I don't speak as fast as Mauricio does, so be patient with me. And then we, as I said, we try to make some comments and suggestions about the ENASIC for a better understanding of the social organization of care work since a rights perspective in Mexico. So I'm going to talk a little bit about this research project. There was a national childcare program in Mexico, and it ended in 2019. And this project provides childcare to families of low resources in Mexico, and the program ended, and it caused, since our perspective, many problems to the families. There are many affectations to the families, to children, and to the personnel of the nurseries. So there are also some changes in the reorganization of child work within the families. So this is what we are trying to show, that there is a privatization of childcare in the families of the beneficiaries, the former beneficiaries of this program. We use the literature about the economy, care economy, social care, and also I didn't write it here, but we also use an approach that has been very helpful, which has to do with circles of care from I don't remember the name of the author, but these circles of care included professional care, family care, and health care. And what we are analyzing in this project is that there is an articulation between these circles of care. Guimaraes is the author of this proposal. And then this project has financial support from CONACYT, Ciencia de Frontera, 2019. And we just finished fieldwork. It was not easy to carry out this project because we had many problems in contacting the beneficiaries of the program that we wanted to interview. So we did some open interviews and participant observation in the communities and visit to childcare centers. And we also conducted a non-representative survey with 44 former beneficiaries of the Sedesol childcare program in the cities of Tijuana, Matamoros in the north of Mexico, Puebla in the center of Mexico, and Mérida in the southeast, because we wanted to have like a national panoramic of this problem. And we also conducted a representative survey with 47 preschool teachers at the Sedesol childcare centers in the same cities, and these teachers were they were working in the former nurseries of the childcare program. So some very few of these nurseries, I mean, most of the nurseries closed because they have no financial support of the program. But we found some of them in each one of these cities. It was not easy, but it was also the way to get to the teachers and then to the beneficiaries of the project. So we had to conduct 3 different fieldwork stages because it was difficult to contact these people. But in using the information of the ENASIC survey, we found that there is some support of this national survey for our small sample, because we also find that, well, we knew that, but this sample also shows that most main care workers, caregivers in the families, they are women, and they spend more time than men in these activities. As you see, this is a comparison between the ENASIC and our small sample, sorry, but some information is in Spanish because we didn't have time to translate. So, and also in this table, which shows the weekly hours that men and women spend in taking care of we focus on children, and as you see, it's similar, no? It is a little bigger in our sample. Women spend more time taking care of children in the families of the beneficiaries that we included in this sample. So also is the mother and the grandmother in our sample that are the main caregivers in these families, and it's very similar to the data from the ENASIC. And I didn't have access to some other information that Mauricio just gave us, but I found some similarities also in terms of that most women in our small sample, they are married, 70% are married, 30% of them are single. So this is very similar to national statistics, even in the census. And at the time of the interview, 60% of them were working, but they were working when they belonged to the program 4 years ago. So some of them lose their jobs because they didn't have anyone to take care of their children, and because some of the reasons that Mauricio also said, because they don't have money to pay the the provision of the service. Some of them engage in the new program, which gives the money directly to them instead of paying to the care center. But experience has shown in this type of direct transfers that women expend the money in other type of things, school uniforms and this kind of things, but not in the provision of service of care service for the small ones. So we also find that these families believe that these women believe that families, mother and father mainly, they are the main responsibles for taking care of children. And just a couple of them say that, well, the state has also some responsibility on this, and they were doing through these programs, but they don't exist anymore. So this has some effects in the expenditure in their incomes, and also there are some similarities in the responses about why they don't use the childcare service, and but for this small sample that used to carry the children to the nurseries, they say they appreciate very much the security, nutrition, they have an academic program, but most of them believe that this is a responsibility of the family, and sometimes if they have to use these services, it's because they need to work. And we find that there was a very important effect on health, because many of them were sick. Even the teachers, we also find that many teachers were sick, and it was a lot of stress on them, not only because they didn't have the childcare program anymore, but also because the pandemic. So these are some of the findings. We believe it's very similar, and for us it's very important, this information, because it supports the findings of this project. So, well, I have here some comments and suggestions, but Mauricio said that this is a survey, national level. There is no enough information to disaggregate the data. So I have that doubt, but it will be wonderful to have this information for the states and cities. We are working with some cities. And well, here is a very important issue for me, because I understand that the ENASIC focus the attention on unpaid care work within the households, and all these different social groups, which are called as independent. As dependent. But the specialists in this topic argue that, well, there is a criticism, and they think that we have to use the concept of independent persons. This is to say that all the people needs care and have the right to give care and to receive care along the life course. So it's like the productive people, it's like they don't need care. They do. And I think that it's important also to have some measure of that. And also we could include like auto care and some other activities that I'm sure that the main, the principal caregivers in the household also provide for them. So, and that maybe that will change the amount of time they invest in these activities. So this is a comment. And well, we have this concern about paid childcare because in our research we found that this is a very important labor force. This was a labor force that was created with this program. This ESOL childcare program has more than 9,000 daycare centers. They provide service to 300,000 children. This was in 2019 when the program ended. So we try to look for some information about school teachers for this age 0 to 5, and there is not enough information. We found in ENOE. In ENOE, there was a category which include them within employers of labor in tourism, sports and personal care. So we think that it's very important to do something about this population, not labor force, not only for those who work in the public childcare centers, for instance, those of IMSS or ISTE, which are public, but we also need like some picture about the features of this labor force. And well, having that on mind, we think that it's very important to show some statistics from our small sample. We interview 47 school teachers. They are called themselves as asistentes educativas. But at the beginning of the program, these school teachers had no schooling. They were not trained to do this work professionally, so they were called the madres cuidadoras. And what we see through this data is that this is something that has been changing through time. And it was during the 12 years that the program was implemented. So most of them are in the age group 30 to 39 years old. And as we see, it was a surprise for me because at the beginning I also conducted a research about this program, and these teachers had no schooling. They had primary school, elementary school, or something like that. But now we see that some of them has high school, secondary school, preparatory school, and technical school, 27% of them, and even some of them had college, 34%. And we found in our investigation that some schools were created to prepare and to train this labor force. And also they have a very important program, a training program as a part of the transfer, indirect transfer program. So they received training, and all of them say that this is one of the best assets they got from the program. And well, some of them have, most of them have between 5 and 10 years of experience, which is very related to the time of the program was in course. And but they have a very precarious labor conditions. Well, their working hours, the 61% of them work 8 hours in average, and their salaries are very low, as we can see here. Most of them earn between it's like $50 and $100 a week. And these are the labor conditions. Very few of them, 20%, have social security. 60%, almost 60% have vacations. Only half of them have a year bonus. And this is very important. This it's like some of them wanted to work in the child care centers because they can take their small children with them. It was like a bonus. So they didn't have to pay for this service, and it was like a compensation for all the rest of the things. And they didn't have medical support. So this shows the precariousness of the salaries and the labor conditions of this female workforce. And for us, it's crucial to identify and characterize the labor force, their salaries, labor organization, and labor conditions at large, because this is a very small sample. And it is also important to analyze their educational profile, and because we believe that there is a process of growing professionalization among this labor force, and we suggest for further surveys to take into account paid childcare, not only in public but also in private institutions. And it's important because this information will help to collocate paid work as a part of the care market alongside with the state, the family, and the community in the social organization of care. And most important, it will also contribute to the signification and evaluation of childcare and social care in general. And I know that this is like a letter to Santa, but we also review some statistics from the National Directory of Economic Units. And we also have here a problem because this directory only distinguishes between private and public childcare centers, but we believe that it's important, the distinctions, for instance, within the public, which ones are from ISTE, from IMSS, PEMEX, etc. And that will be helpful also if the NUE includes the data disaggregated to local level. So we have some advice from INEGI in Tijuana, but they say, oh, I'm sorry, we can't help you. We needed this data to analyze the social organization of care in every in every city, but we couldn't have this information from the NUI. So I think these are all the comments, and thank you very much. Thank you for your patience.
Ok, bueno, si podemos pasar por favor a la mesa. De hecho, te voy a dar este.
Gracias.
Ahorita las personas que gusten hacer alguna pregunta, participar, me levantan mano para llevarles el micrófono, por favor. Acá.
Hola, en principio felicidades, creo que es un trabajo enorme y muy necesario, específicamente posterior a la pandemia. Creo que fue evidente debido a las restricciones de movilidad, el sobrecargo del trabajo de cuidados y la importancia que tiene para la vida social estas como pequeñas y uso comillas actividades cotidianas, ¿no? Hago algunos apuntes a partir de las dos presentaciones, ¿no? Y una es, creo que sería muy bueno que nos presentaran desde el principio una como definición de qué está entendiendo el INEGI por cuidados, porque no está presente en la presentación. Ya luego vi que en el documento sí lo hay toda una reflexión metodológica al respecto. Por otro lado, creo que sería muy útil ver el tema del colapso del cuidador, que es algo que sacó el IMSS en el 2015 y que nos permite como visualizar, por un lado, los costos fisiológicos, emocionales, económicos y políticos que tiene el desempeño de trabajo de cuidados, principalmente en las mujeres, porque, bueno, los resultados lo muestran de manera muy evidente, ¿no? Y por otro lado, nos dice mucho, y coincido con Silvia en reflexionar sobre el tema del autocuidado, ¿no? Pero creo que hay que tener como un cierto cuidado con la idea de autocuidado en el sentido de cuando se vuelve una atomización de políticas públicas que están como encareciendo la vida, ¿no? Entonces, el trabajo de Silvia y de Karen me parece muy importante para mirar cómo estas instituciones que permiten el desahogo del trabajo de cuidados se están desmantelando, ¿no? Y qué pasó en la pandemia con el recorte del presupuesto a guarderías, centros de cuidado de la salud, etcétera. Entonces, creo que es un avance enorme, no quiero dejar de celebrarlo, pero al mismo tiempo como nos muestra la articulación de la intimidad en la vida de los hogares con las políticas estructurales de reproducción de la vida. Gracias.
Todos hablan español, digo, si no para… Sí, digo, si no responden en Spanglish, pero está bien, entonces en español es más rápido. No, efectivamente, perdón, tu nombre no… Jared. Pero efectivamente no presenté la definición de cuidado porque, bueno, ahí está la definición conceptual en el documento, porque precisamente es toda una discusión gigantesca que se tiene al respecto. Digo, tenemos que llegar a algo, siempre lo que nos limita es cómo lo operacionalizamos, ¿no? Entonces, si están haciendo trabajos de tesis o algo, están seguramente enfrentándose a ese problema, ¿no? Como un concepto, algo abstracto lo tengo que operacionalizar en términos estadísticos, entonces tenemos que llegar a ciertas actividades, ciertas condiciones que nos permiten identificar el cuidado. Y de hecho, hace unas semanas estuve en la OIT y hubo una presentación de la OIT precisamente hablando de la necesidad de una definición estadística de cuidado, ¿no? O sea, tenemos una definición, o sea, conceptualmente estamos trabajando, avanzando mucho, pero de repente cuando digo, bueno, ¿y cómo lo plasmo, no? ¿Cómo lo capturo? Precisamente esa es una discusión muy grande que está llevándose a cabo y en mayo va a haber una presentación en la Ciudad de México sobre estos temas precisamente de cómo definimos estadísticamente el cuidado, pero sí, les invito a leer el documento metodológico que está muy completo. Y sí, efectivamente… solamente destacar, sí, no le hago justicia a la encuesta es súper poderosa, hay tantas dimensiones, hay toda una sección de personas viviendo solas, Aquí solamente hice énfasis en las personas de 60 años y más viviendo solas, pero hay toda una batería de personas en general viviendo solas, ¿no? Entonces, ahí se puede sacar precisamente esto de, bueno, cuando te enfermas, cuando haces esto, o sea, todo esto, si viene, ¿no? Me habría pasado toda la mañana aquí, sería una cátedra completa de la ENASIC toda esta semana, porque hay tantos temas en la encuesta que es poderosísima. Entonces, sí nos quedamos cortos en la presentación, pero sí la información está ahí, la información está muy relevante. Lo mismo hice énfasis en los padres, cuando no tienen hijos que no viven con ellos, pero es toda una batería de padres y madres que tienen hijos que no viven con ellos, ¿no? Entonces, se puede rescatar muchísima información de esto. Pero bueno, claro, ahorita escogí eso porque también tenemos el padrón de deudores alimentarios. Entonces, como que dije, bueno, eso es una pregunta que nos hacen al menos una vez a la semana. Llega INEGI la solicitud de ¿cuántos padres no pagan a los hijos? Bueno, pues ahí está la información, que es además autodeclarada. Entonces, puede que ellos no paguen, pero nos dijeron que sí. Entonces, eso falta también revisarlo, ¿no? Y solamente antes de dar la palabra a Silvia para sus comentarios, efectivamente, esta es una parte, por eso sí quise empezar diciendo, bueno, tenemos las ENUD, que ya tenemos una tradición muy larga en encuestas de uso de tiempo, que nos da una dimensión de las horas de cuidado. Tenemos tenemos la ELCOS, la de Seguridad Social, la misma ENOE, que si bien no está enfocada en estos temas, nos da algo. La encuesta de trabajo infantil, que también tenemos ahí, por ejemplo, cuántas, principalmente niñas y adolescentes, mujeres, están dedicando horas de trabajo de quehaceres domésticos en situaciones no adecuadas, ¿no? Entonces, es toda una gran cantidad de información, que yo creo que la parte compleja a veces es cómo ir sacando y cómo vincular todas las fuentes. Ahí en INEGI pues nos tenemos que dar un poco al margen de producimos, les aventamos a la academia los insumos y bueno, y ayúdanos a explotar la información, ¿no? Pero claramente todas estas solicitudes y todos estos comentarios sí nos los llevamos porque tenemos que empezar a replantearnos. Como decía, tenemos un envejecimiento en México que viene muy acelerado. Tenemos además encarecimiento de vivienda. Tenemos dificultades para llegar a la seguridad social, no tenemos acceso a las pensiones. Entonces hay unas generaciones que vienen, y ahí ya siento acá el envejecimiento y la falta de pensiones en el futuro, que vamos a tener que hacer frente a unas condiciones no favorables de retiro, y entonces ahí tendríamos que ver pues los autocuidados o ser roomies de alguien más de 60 y tantos años, todos ahí viviendo juntos en unas comunas. No sé qué vamos a hacer, ¿no? Pero bueno, son preguntas a futuro que claramente nos hacen preguntarnos más cosas. Yo siempre he dicho, una buena encuesta, así como un buen proyecto de investigación, da más preguntas que respuestas, ¿no? Entonces, precisamente esto motiva mucho a que salgan más preguntas y ojalá y muchos de ustedes estén haciendo tesis o estén en posgrados, haciendo investigación de todo esto para que precisamente utilicen esto y todo el apoyo técnico que necesiten. Ahí está, bueno, está Octavio, pero también estoy yo para apoyarles con todo lo que sea necesario, ¿no?
Okay. I suffer a lot speaking English, so I'm glad to speak Spanish. Gracias por las preguntas. Bueno, sin duda, sí, yo creo que esta es una encuesta que tiene un potencial enorme, porque bueno, solamente había visto como las presentaciones para la prensa y eso, y pues eran como alguna parte solo de los datos. Entonces sí estoy muy contenta por toda esta información que tiene para cada uno de los grupos que reciben cuidado y los que dan cuidado, ¿no? Bueno, en particular nosotros pues estamos interesadas en los niños pequeños, en la primera infancia, y pues sin duda esta información es muy valiosa para nosotros y bueno, yo espero que esta encuesta pues tenga otras versiones, ¿no? Así como ha sido la ENUD, que es muy importante tener como estas series de tiempo. Y sí, yo quería hacer énfasis en bueno, sí entiendo que debe de haber una definición estadística del cuidado y que sería importante considerar en ello que me preocupa esta cuestión del cuidado de los dependientes, ¿no? Y porque finalmente el cuidado es relacional, entonces yo tengo que cuidar a mi pequeño hijo, eso afecta mis actividades, ¿no? Entonces hay que verlo también desde esa perspectiva relacional. Y gracias, Yaret, por el comentario. Sí, la articulación y desarticulación de las políticas es lo que estamos tratando de demostrar en este proyecto, porque cuando las mujeres tienen acceso a los servicios de cuidado, la situación es una, los arreglos familiares son unos, pero entonces si un programa, que era un programa nacional como este, de las estancias infantiles, se retira, entonces ha provocado un caos enorme, con consecuencias políticas, económicas, sociales y también en un cambio en la cultura del cuidado. Eso es algo que hemos podido ver en este estudio, que las estancias infantiles trajeron a las familias de las beneficiarias nuevas maneras de crianza, una nueva cultura de crianza, y que, por ejemplo, las madres pueden ver eso con los hijos pequeños y los grandes, ¿no? O sea, los grandes tuvieron una crianza, fueron a la estancia infantil y los pequeños no, y ellas lo notan en muchas cosas. Entonces hay como un cambio generacional y es algo que se ha ido perdiendo, y bueno, la intención es con este estudio pues mostrar todas las consecuencias de no tener estos servicios, y pues que desde nuestro punto de vista no fue una buena decisión, que este programa de transferencias indirectas se convirtiera en uno de transferencias directas. Y bueno, hemos podido ver cómo las familias pues tienen que implementar toda una serie de estrategias en los hogares para poder cubrir ese faltante de cuidado que les daba la estancia infantil, y cómo pues muchas mujeres pues volvieron al hogar, ¿no? Entonces aquí donde decimos que hay o sea, el gobierno federal dice que este era un programa que privatizaba porque les daban el dinero a negocios, ¿no? A las guarderías, que eran negocios, pero desde un punto de vista del feminismo, pues nosotros consideramos que hay una reprivatización del cuidado en las familias, y esto, bueno, no es nuevo, ¿no? Siempre en las crisis sociales las familias cargan con todos los costos de las crisis económicas y sociales, y pues este es también el caso, ¿no? Hay un proceso de reprivatización del cuidado, pero también de familiarización. Gracias.
Permiso, para acá.
Bueno, pues sigo en español. Muchísimas gracias. La verdad es que pues es una suerte poder contar con este tipo de encuesta. Creo que el INEGI va adelante de la política en este sentido. El envejecimiento es claro, los cuidados van a ser cada vez más grandes y la estadística va por delante de la política en estos momentos. Me da mucho gusto y ojalá sea utilizada. Entonces, en este sentido van dos preguntas. La primera es, ¿qué sigue para la ENASIC? O sea, que están previstos tener que sea una encuesta periódica, presupuesto, también el tema de la federalización, ¿no? O tener los resultados por estados y así. O sea, ¿sigue eso o no? ¿Cómo lo ven? Y luego, desde el otro punto de vista, creo que hay dos cosas fundamentales que trae la encuesta. Una es la necesidad de cuidados profesionales, o sea, profesionalizados. Quieren gente con skills, con habilidades. Entonces, creo que es importantísimo de esta encuesta, o sea, pues que nos da primero, toda una área de oportunidad profesional de universidades, escuelas técnicas, que va a ser cada vez más necesario, ¿no? Entonces, creo que esta es una información, y eso que ustedes la puedan compartir con universidades y con escuelas de educación media y media superior y superior, creo que es súper importante, porque pues ahí hay un área ¿no? Fundamental. Y la otra es sobre la situación laboral de los cuidadores, ¿no? Creo que ahí sí se están, ¿no? La unión entre esta encuesta, la ENIG y la ENOE es increíble para ver cómo va a ser esa condición laboral de los cuidadores, que no solo van a tener que estar profesionalizados, o sería ideal que estuvieran profesionalizados, sino saber qué condiciones va a tener, porque entiendo que si seguimos así va a ser una de las áreas de ocupación principales en México. Muchas gracias.
Bueno, rápidamente, gracias. Sí, bueno, ¿qué sigue? Bueno, pues nosotros estamos, lo primero es difundir la encuesta. Yo creo que la encuesta, si no se usa, pues ahí va a quedarse, ¿no? Entonces, sí, precisamente es en estos foros, en muchos foros, por ahí tenemos estrategias, ya estamos haciendo estrategias para que se le siga dando presencia, que se pueda utilizar, y eso nos puede ayudar en un futuro cuando pidamos recursos. Dependemos, al final de cuentas, de asignaciones presupuestales federales, ¿no? Entonces, y tenemos por política de la institución información que es de interés nacional, que tiene prioridad para asignarle recursos, como es la ENOE, la ENIC, la ENUD, los censos. Entonces, en realidad sí tenemos que primero atender esas necesidades de información y ya después ir acomodando esas. Entonces, pues esperemos, sí tenemos planes de seguir moviendo la encuesta, esperamos tener los recursos para poder llevar a cabo una siguiente edición y poder llegar a nivel de entidad federativa y además la distinción rural-urbano, ¿no? Porque estamos viendo, no es lo mismo, bueno, yo llevo viviendo en Aguascalientes 10 meses y desplazarme de un lado de la ciudad a otra, aunque la gente de Aguascalientes se queja, me toma a lo más 20 minutos, ¿no? Cuando en la Ciudad de México 20 minutos vives aquí a la vuelta, ¿no? Porque en realidad estás a 2 cuadras y Tijuana seguramente tiene sus propios problemas de tránsito. Ayer lo vi aquí en la Interestatal también, se llegan a cargar. Entonces, tenemos que tomar en cuenta esas diferencias, ¿no? Pero en realidad, ¿qué sigue? Pues sí, primero moverla. Nos ayudan mucho ustedes como usuarias, como usuarios en generar esa demanda de información adicional para nosotros poder llevar a cabo una siguiente edición cuando tengamos el recurso suficiente para poder llevarlo a cabo. Y claro, como decías, esta vinculación de poder agarrar ENIC, qué implicaciones tiene ENUD, qué implicaciones tiene la misma ENOE. Estamos en un proceso muy complicado también de estandarizar entre instrumentos, preguntar de la misma manera a través de instrumentos hasta donde se pueda. Claramente la ENIC va a preguntar más sobre ingresos de manera detallada que la ENOE, pero al menos tener preguntas estandarizadas es un proceso bastante complejo en el instituto para que uno pueda decir, ok, agarro esta información de acá, esta información de acá, esta información de acá y sé que me están midiendo lo mismo, ¿no? Porque eso es un reto que tenemos para poder usar fuentes de información de manera transversal. Y además también, y un poco dando respuesta un poco adelantada a lo que preguntaba Silvia del DNUE, también trabajar más en los registros administrativos. Tenemos ahí un área de oportunidad muy grande. El IMSS nos comparte información cada mes, el ISSSTE también, pero cuando tenemos a las estancias infantiles, bueno, ahora ya no se llama estancias infantiles, los centros de atención temprana, esos van a entrar por Secretaría de Salud. Entonces, tenemos que ver cómo conseguir esa información. Entonces, está esta desarticulación nuevamente de dónde está todo y por qué muchos países, cuando vieron el mapa al inicio, no vienen muchos países europeos más que el Reino Unido. Tienen registros administrativos que permiten recuperar algo, no llegan a tanto de esa información, pero necesitamos trabajar más ahí para poder saber, bueno, dónde están, cuánto cuesta, porque aunque sabemos que hay subsidios, pues siguen pagando algo los usuarios de estos centros y poder vincularlo de mejor manera a lo que nos dice la encuesta, ¿no? Porque tal vez sí, pues no tengo ninguno cercano o tengo uno cercano, pero es el triple de lo que es mi salario, ¿no? Entonces, pues no voy a utilizar esos centros. Y bueno, y muchas veces podría quedarme aquí hablando más tiempo, pero mejor le doy la palabra a Silvia para que comente.
Bueno, sí, como yo decía, por ejemplo, lo vimos en este proyecto que estamos haciendo sobre las estancias infantiles, pues se creó un enorme mercado de trabajo, ¿no? Y este es sector público, pero claro, desde luego hay muchos profesionales en el sector privado, pero sí me pareció muy interesante ver el progreso, ¿no? En la profesionalización de esta fuerza de trabajo, que sin embargo, como decía, es precaria, pues porque son actividades que están asociadas a la esfera doméstica, ¿no? Entonces todavía hay ahí esa carga ideológica muy, muy fuerte, pero también es importante ver cómo pues surgieron escuelas profesionales, o sea, con carreras, con puericultura y muchos cursos de capacitación en las escuelas técnicas. Entonces esto me parece pues muy importante, ¿no? Y bueno, tocaste también, Mauricio, el tema, me recordó lo de la movilidad y los cuidados, ¿no? Ojalá que algún día pues la ENASIC o alguna otra encuesta, a lo mejor hay estas encuestas de transporte que miden los tiempos de transporte en el auto y el tren y etcétera, pero la movilidad de los cuidados es muy importante porque, bueno, precisamente ahora en un curso estamos revisando esa literatura y es muy claro pues como la movilidad de las mujeres es diferente a la de los hombres, que quizás se mueven en un radio menor que los varones, pero sus movilidades son así como, o sea, muy, muy movidas realmente, ¿no? Entonces ojalá que, bueno, más adelante se pueda hacer también eso. Y pues lo que dices de que estos centros de atención temprana ahora están registrados en salud, bueno, pues no sé cómo podemos saber más acerca de ellos. Así es, tendremos que esperar.
¿Otra pregunta? ¿Alguien quiere participar? ¿Algo que desea agregar?
Bueno, no, solamente invitarles a explorar la encuesta. Sé que tal vez no todo el mundo le encante meterse en los datos. Yo soy un fanático de procesar bases de datos, entonces, pero bueno, ahí está, hay muchos tabulados ya también predefinidos. En ese caso pues no se puede, pero en algunas encuestas estamos haciendo un esfuerzo por crear tabulados a nivel estatal. Esta no nos los permite el diseño de la encuesta, pero sí a que la utilicen y que, digamos, la aprovechen al máximo. Y hablando también de la importancia de la información, ahorita que mencionabas lo de las movilidades, hay un proyecto que salió hace poco usando información censal, usando información del DNUE y bueno, no recuerdo qué otros datos usaron, en mujeres con el Colegio de México, creo, este mapa de cuidados. Entonces, pero esa ahorita es para todo el país, entonces puedes ponerle, yo vivo acá, quiero este centro de atención y te marca la distancia, te marca muchas cosas. Entonces, ese es un ejemplo de cómo precisamente vincular la información que está ahí, que había estado desde ahí hace varios años y que, bueno, hubo una iniciativa, también hubo recursos que se movilizaron para ese proyecto. Se pudo hacer un mapa que facilita, de cierta manera, identificar centros de atención para distintos grupos objetivo. Y que bueno, y es una forma creativa de usar los datos y que precisamente es lo que se buscaría, ¿no? Si tenemos una encuesta de origen-destino, no se ha vuelto a hacer, esa era para la zona metropolitana de la Ciudad de México, porque bueno, claramente esa zona metropolitana tiene sus particularidades y fuera de eso nada más tenemos en los censos de población la pregunta de en qué municipio trabajas y dónde vives y cómo te transportas. Entonces, se usa mucho aquí en el norte para decir, bueno, ¿dónde trabajas? Pues trabajo en Estados Unidos, ok, sabemos cuánta gente que nos los reporte, también por favor reporten eso en las encuestas y el censo, que dicen, yo vivo en Tijuana, pero trabajo en Estados Unidos, ¿no? Entonces, podemos saber esta movilidad que hay transfronteriza, pero también ocurre en Ciudad de México, en mismo Aguascalientes con Zacatecas, o sea, todas estas zonas nos ayudan a definir incluso zonas metropolitanas, nos ayudan a definir muchas cosas y políticas, pero justo la información está, no quiero decir segmentada, ya atomizada tal vez en muchas áreas, entonces hay que ser muy creativos en jalar la información que necesitamos para usarla y pues eso es todo un reto, ¿no? Entonces yo ahí le dejaría. Si tienen más preguntas específicas, con mucho gusto les atiendo.
Gracias, pues yo nuevamente darle las gracias a INEGI por haber producido esta información, estamos muy contentas, seguro que la vamos a usar. Este es un estudio más cualitativo, el que estamos haciendo con las estancias infantiles, pero sin duda alguna pues es un importante insumo para nuestro proyecto. Y en el camino veníamos comentando, ¿no?, de la que se llama Encuesta Nacional para el Sistema Integral de Cuidado. Y entonces, bueno, a lo mejor esa pregunta es más política, pero, o sea, de veras sí se va a usar para eso, porque, bueno, sabemos que hay un sistema, hay una propuesta del Sistema Nacional de Cuidados que está ahí durmiendo el sueño a los justos en un cajón del Senado. Entonces, no sé si INEGI sabe algo al respecto o vaya, ¿qué relación tiene? Si nos puedes comentar algo, si no, no importa. Muchas gracias.
Sí, efectivamente, se llama para el sistema de cuidados pensando en esta necesidad de información que había. Claramente hay una propuesta, está detenida en el Senado, es lo que sabemos también nosotros, o sea, fue como un esfuerzo de, bueno, igual y si se puede saturar un poco con esta información, aquí está la información, ¿no? Es importante porque en realidad Y creo que es algo muy prudente que INEGI no hacemos política. Entonces, sí estamos muy abiertos a recibir las solicitudes de información, las necesidades de información, porque luego nos dicen, oigan, ¿y esto es bueno o malo? Aquí está, ¿no? Porque no podemos ser, productores y además evaluar, o sea, como juez y parte está medio complicado, ¿no? Entonces, sí nos mantenemos al margen, pero efectivamente tiene este nombre porque se gestó en el contexto con la idea del sistema de cuidados, que efectivamente hay una iniciativa, y todo se puede mejorar, se pueden hacer adecuaciones, y seguramente la información que da la encuesta va a decir, oigan, por acá estaba viendo, pero mejor modificamos esto, ¿no? Entonces, esa es la idea, que la información que se produce en INEGI, que además es pública y digamos, sale de los impuestos que todas y todos pagamos, entonces en realidad que se utilice para ese tipo de políticas, ¿no? Pero sí, el nombre está relacionado con eso.
Gracias. Un aplauso, por favor.